Almotriptan is a 5-HT1B/1D receptor agonist used to treat migraines. In this video, let's found. What is almotriptan? What is almotriptan used for? Contraindication. What are the side effects of taking almotriptan? How does almotriptan work? How to use almotriptan? What is almotriptan? Almotriptan is a triptan medication discovered and developed by Almirall for the treatment of heavy migraine headaches. It was patented in 1992 and approved for medical use in 2000. What is almotriptan used for? For the treatment of acute migraine headache in adults. Contraindication. As with other triptans, almotriptan should not be used in patients with a history, symptoms or signs of ischemic heart disease, myocardial infarction, angina pectoris, documented silent ischemia, Prinzmetal's angina, or severe hypertension and uncontrolled mild or moderate hypertension. Other contraindications are previous cerebrovascular accident, CVA, or transient ischemic attack, TIA, peripheral vascular disease, severe hepatic impairment, concomitant administration of ergotamine derivatives, including methosergide, and other 5-HT1B/D agonists. Side effects: burning, crawling, itching, numbness, prickling, pins and needles, or tingling feelings. Discharge from the eye. Eye irritation. Fast, irregular, pounding, or racing heartbeat or pulse. Itching, redness, or swelling of the skin. Neck pain or rigid neck. Redness of the inner lining of the eyelid. Skin rash. Pharmacodynamic. Almotriptan is a selective 5-hydroxytryptamine receptor subtype agonist indicated for the acute treatment of migraine attacks with or without aura in adults. Almotriptan is not intended for the prophylactic therapy of migraine or for use in the management of hemiplegic or basilar migraine. Almotriptan is an agonist for a vascular 5-hydroxytryptamine receptor subtype, probably a member of the 5-HT1D family, having only a weak affinity for 5-HT1A, 5-HT5A, and 5-HT7 receptors and no significant affinity or pharmacological activity at 5-HT2. 5-HT3 or 5-HT4 receptor subtypes or at alpha-1, alpha-2, or beta-adrenergic, dopamine-1, dopamine-2, muscarinic, or benzodiazepine receptors. This action in humans correlates with the relief of migraine headache. In addition to causing vasoconstriction, experimental data from animal studies show that almotriptan also activates 5-HT1 receptors on peripheral terminals of the trigeminal nerve innervating cranial blood vessels, which may also contribute to the anti-migrainous effect of almotriptan in humans. Mechanism of action. Almotriptan binds with high affinity to human 5-HT1B and 5-HT1D receptors, leading to cranial blood vessel constriction. Half-life: 3 to 4 hours. Dose: migraine. Indicated for acute treatment of migraine attacks in patients with a history of migraine with or without aura. Initial 6.25 to 12.5 mg PO at onset, may repeat once after 2 hours. Not to exceed 25 mg per day. Not for treatment of cluster headaches. Safety advice. U.S. FDA Pregnancy Category C, animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about almotriptan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.